So welcome everyone to our Breast Cancer Care WA webinar. These webinars are part of our Living Well program, and we have the wonderful accredited practicing dietitian, very experienced oncology dietitian Adele Hug, here to share with us about eating well after breast cancer treatment. And so before I hand you over to Adele, I do just want to acknowledge the traditional owners of the lands that we're meeting on. I'm streaming here from Whadjuk Noongar country in Perth or Burlew, Western Australia. And I invite you to acknowledge in your own heart and mind the traditional owners of the lands that you are on today. We remember them and we honour the elders of the past and the current generations as well. Over to you, Adele.
Lovely. Thank you very much. So I have some slides today, and I am also going to take you through just a few summary papers that I just want to show you as a general. So I'll be flicking on and off from the screen, but hopefully it'll work. Just let Chandrika know if there's any issues with being able to see so that she can let me know, because most of the time I can't see you all and can't tell what is happening. So let me get started and get my screens all ready for us. Perfect. Now, can you see? No, you won't be able to yet. Hold on. Lovely. Can you see the slides? Can.
Yes, and I can see some thumbs up. Before you launch in, Adele, we did forget to mention the Q&A box. So I just saw a message there from Dale who says they can't unmute. That is right. So you're in a webinar setup, which means you can't be seen or heard. That means we can use this recording as a resource that will go on our website in future. However, we do welcome your questions. So if you're in the audience today, please you can use either the chat box or the Q&A box, and you can type your questions in there. I think depending on what kind of device you're on, not everyone can see chat, but everyone should be able to see the Q&A. So if you hover your mouse along probably the top of your screen to the Q&A speech bubbles, you can type in there. Okay.
Thank you,
I'll shush now and you can go for it, Adele.
Excellent. So lovely. So thank you all for coming this afternoon. As Chandrika said, my name is Adele Hug and I am an oncology dietitian. I am here today to talk to you about eating well after breast cancer treatment. So we're going to have a deep dive into the evidence. And then, as I always like to do, is talk through quite practical tips and tricks for you moving forward after breast cancer treatment. So I'll just start by thanking Breast Cancer Care WA. Without their support, I wouldn't be able to update myself on this evidence to then share with you. So very grateful for the opportunity. And this is my third out of 4 sessions. So a little bit about me, if you haven't come to any of my sessions before, most of my oncology experience was in the UK. And I was very lucky to be part of a large oncology dietitian team, and we worked supporting people with lots of different cancers. I was part of the general oncology team, so breast cancer was a big part of my caseload, and it ended up being somewhere I had a special interest, as it's often somewhere that dietitians don't necessarily have a focus on. And I've actually found the same thing stepping over, well, half the way around the world, that it's a similar situation here. So I am really happy to be able to give you this information and hopefully help you see where some of it is available for you to keep up to date. Obviously, this is very general information. Everyone here will have had a different journey to get to this point, and your particular disease, your particular treatment, all the things about you are going to be individual to you. And what I do is hopefully help to collate some of that information, make it a little bit easier to digest, pardon the pun, and also translate it into some easy tips that will really help to work for you in your life. So as I said, we've had some other sessions, and I'll refer to those if there's specific things that are helpful for you to maybe reflect back on in those sessions. And we do still have one session left, and that's Eating Well with Metastatic Breast Cancer, and that is next month. So, but today we're going to really focus on the steps after treatment, and with particular focus on the evidence eating after breast cancer treatment, and some of the consequences of cancer treatment, those being menopause, keeping an eye on our cardiovascular health and our bone health. I'm going to talk a bit about rehab and then finish with a Q&A. So as Chandrika said, please do ask any questions that you have. And also, I've got some questions that I've been asked in the past that if for some reason we don't have as many questions, I'm very happy to start to tick through those. So often there might have been something you've thought of at another time. And the other thing that I would say is obviously as you move through after your breast cancer treatment, do make sure that you keep in touch with your GP, if any, or your oncologist, if any of your symptoms do change, as it's an important part. And the advice that I'm providing today doesn't replace any specific information that you had from your team. So in the last session, we were talking about eating well during breast cancer treatment. And so most of that was around sort of things around chemotherapy, radiotherapy, possibly immunotherapy. I'm going to talk a bit more about immunotherapy in the next session, as most of the regimens are for metastatic breast cancer. But I'm actually going to talk through, some of you may still be on targeted therapies, as some of those courses last a lot longer post some of the more intensive treatments. Some of you might be on hormone therapy for quite a while. Some of you may be on surveillance or even post that. And all this information is very relevant to each of you and comes with their own challenges. So I'm going to start with the evidence on eating after breast cancer treatment. So I did a big deep dive into where the current evidence is. So one of the previous roles that I did was as a survivorship ambassador for the World Cancer Research Fund. So that is a collaboration including the international, I can't remember the other, I've lost the other group that works with the World Cancer Research Fund, but it's a group that's connected across America and Europe and Australia. There is a branch in over east, I think it is in Sydney. And what they do is really, you know, they're the nerdiest people that you can imagine, which is what I love. And they pull together a lot of the research to help give us, clinicians and yourself, really what the evidence is and what it's not, and where we're at when it comes to advising or giving suggestions around eating after breast cancer. So they're working on four different main projects. They work around cancer incidence, cancer survivorship, cancer mechanisms, and they've got a specific research group on body fatness and the role that that might be playing. So what I'm going to focus on is the evidence around cancer survivorship. The World Cancer Research Fund has only delved into collecting and collating the evidence into transferable advice for breast cancer. The first report was in 2018, and they've just released one for colorectal cancer. So there isn't as much research after breast cancer diagnosis on preventing recurrence or improving mortality, which is the chance of death. So what we're looking at is a smaller group of research studies and how that translates across to us. So here is actually the summary. So this is from the 2018 papers, and this was collating all together. And we're talking about breast cancer survival when we're looking at post-treatment. So as you can see, the top rows, strong evidence, convincing, probable. We have nothing in those. So that is the top area where we're looking at giving the best advice. What we're looking at is limited evidence, suggestive. So these things are things that we as researchers think are going to decrease the risk of recurrence or increase that risk. So these things are still limited evidence, and that's one of the challenges when it comes to moving on past breast cancer treatment. What is the best for you? But these can give us some guidance, and the good thing around them is none of them are very challenging, apart from the soy, which I'm going to delve into in a little bit more detail in a moment. But before I go to that, I just think it's helpful. I'm going to stop the show and come back to it. And I've just pulled out the main papers that are used for this summary. And don't worry, I'm not going to start reading out sections from them. But the reason I want to show you them is just not only the level of humans that go into these papers, but is really some of the different pieces of evidence. These are all the different studies and all the different pieces of evidence that they're looking at when they're looking at different pieces to advise you. So it's really loads and loads of different things that come in. And one of the things that I really like are some of these summary of conclusions that can show sort of how strong or weak evidence is. And the good thing about World Cancer Research Fund and the evidence that they produce is things that have been studied and there's no evidence. They also report on that, which is also really interesting. So I can definitely share. I did see someone pop up and said, love the references. I can definitely share them. They're all open to the public. And if it's your thing, then it's helpful. But I also hope that it reassures you that what we're talking about today and the evidence that we've got in the background for it. Let me go back to my slides. Lovely. Okay. So I'm going to take us through some of these. And the first thing is soy. So the first thing that I'm going to take you through is some of those steps. So some of the studies that they reviewed was 108 studies that included 151,000 women. Let me just get rid of those. Unless anyone needs them, do pipe back up. There we go. And they actually found some limited evidence that soy could reduce the risk of death after a breast cancer diagnosis. There was some evidence on more dietary fibre, so that was a 13% lower risk, and some limited evidence on healthy eating patterns, which I'm going to talk about. So to focus a bit more on soya, soy contains isoflavones, which are weak estrogen-like compounds. They're under the umbrella of phytonutrients, which is a plant nutrient. So they are, whilst they look like estrogen to the body, what they actually do is bind estrogen and bind an estrogen receptor and prevent that response rather than being a promoter. And I thought, just to help explain this a little bit better, I'm going a bit sciencey, aren't I, today? On the left, you can see one of the metabolites of the soy isoflavones. And what it does is in the body, it goes to these two molecules, that I can't pronounce, on the bottom left. And then on the right, the three molecules are estrogen, active estrogen products. So you can see that they're similar in shape. And when they see that estrogen receptor, they bind into that. And that is where you would either have estrogen that would promote or soy that would block. So that is the theory behind why soy is protective, but also why it was assumed to be something to avoid in the past. And it's one of those things that we've got more evidence, and it's still growing on the benefits of soy. I believe it's about 60 milligrams a day. That is the best, which is 2 to 3 serves of soy. So if we head back here, we've got loads of different soy products that you can choose from to your preference, if it's something that you want to include. So don't feel that it's something that you have to, but if it's something that you want to try, give them a whirl. The other thing that's important is we don't have enough evidence on the safety of soy supplements or isoflavone supplements. So we're not sure if a processed product has the same outcomes or not. So they're not recommended at the moment. It's soy foods preferred rather than a soya supplement. We'll see if you do have any questions. I'm happy to take those at the end. So the other thing that came out of the review of the evidence is that certain dietary patterns are supportive of reducing the risk. And this is where we come back to a traditional style of eating, which often for many of us is a Mediterranean style, but there are other options available. And it can include a vegetarian or a vegan vegan diet. These foods, again, they are often very fiber rich. So we're looking at more plants, more colors, less processed, less meats, but they're still included. So there's no sort of hard and fast rule of excluding things along there. We're just looking at more protein, more dietary fiber to really be able to boost our body and our health. And this is where one of the main changes is that you might step away from some of the things that helped get you through your treatment. So I spoke last time that often during treatment, if you're suffering from certain side effects, we definitely relax some of those healthy eating rules. When we're stepping out into treatment, it's starting to move into more of those healthy habits and helping to find that support that you can to incorporate those things. So that might be speaking to a dietitian about your diet in particular, if it's something that you're struggling with. There isn't the evidence needing to go vegetarian or vegan, but there is the evidence of more plants is better. So that's where we definitely recommend basing your diet on plant-based foods, including plant-based proteins. So it's a little bit of an advice switch from when you're on treatment to moving away from treatment. The timelines for that, though, are going to be very different for everyone because some people are still affected by different side effects. I'll come to some of those in a bit, but don't feel the pressure to need to be excelling into this super healthy diet if your body is still in recovery. And we'll come to that as we develop through this session. So the other thing that is very clear in the evidence is on physical activity reducing the risk of breast cancer, reducing the risk of breast cancer returning after a diagnosis and supporting a reduced mortality. We find that the evidence shows it can slow the progression of a cancer and improve the chances of survival. And actually, the Oncology Group of Australia would prescribe exercise if we can. So for World Cancer Research Fund, with their review, they took 23 studies from around the world that had 30,000 women in them. And it showed that there was some limited evidence that the most active women had an estimated 44% reduced risk of mortality, and 42% for breast cancer mortality, and some limited evidence that physical activity could reduce the risk of breast cancer recurrence. So how does this translate to yourself? What they actually did is some investigations on the intensity, which is sort of the body's rate of using oxygen as a measure for the benefits of activity. And they found the more intense, the better. And that translated into sort of an improvement as the analysis went through. So it was, let me have a look. So if someone had a 10 unit, which is this measurement, MET they call it, increase in physical activity, it helped 14% with breast cancer mortality. And then we've got 20 MET, so double that, had a 38% reduced risk of breast cancer mortality. So we've got further evidence that we need to delve into about this. But how does this translate for you? So what I like to use is this acronym called FIT, which is frequency, intensity, and time. And for yourself, focusing on any of those three to improve or to increase is going to improve things for your fitness. So whether that's you might frequently change to walk from every second day to every day, You might still walk every second day, but you might walk and get a bit more puffed. So that might include more hills or walking faster, or you might walk for longer. So it's very individual again to what's going to fit into your life, but using that FIT acronym can sometimes help you focus, as focusing on just doing more is sometimes not the right idea. There are exercise physiologists that are that can support you post-cancer treatment. And I'd recommend that if you're having any struggles, reaching out to get some support. You can get a care plan from your GP as well for those, so that they can actually help you exercise with your ability and improve on that. So now I'm going to spend a little bit of time talking through the consequences of cancer treatment. So these are often referred to as late or long-term side effects. So they can actually come quite quickly, or you might have already had some alongside your treatment, or they can come on quite late down the line. And we'll take ourselves through some of these, and you'll understand what I mean when I'm talking about something like changes to your heart health, which I forgot to put on this list. So hopefully we can have a little delve into some of the things that can happen more long term after a breast cancer diagnosis, breast cancer treatment, that's important for you to think about, alongside those other pieces of information that we spoke about. So it will give you a little bit more detail. So I'm going to start with bone health. So some breast cancer treatments that you may have had during your intensive treatment, or some long-term therapies, can actually increase bone loss or affect our bone health. It can lead to things like osteopenia, which is weakness, or osteoporosis, which is when the bones are really thin. I wonder how, if you have a little think to yourself now, how would you know if you're at risk or if you have osteoporosis? And what most of you, I think, might be thinking is that you might not know without seeing a doctor. So if it is something that you're at risk of, making sure that the regular checkups are had, that if you need any scans, any investigations that are going to help support your bone health, that is important, just as important, if not more, as some of these top tips here when it comes to diet and lifestyle. So maybe not a surprise, the top tips are pretty straightforward when it comes to bone health, but calcium and vitamin D are your key nutrients to eat with food. But also, if you're at risk, most of you would probably be on a supplement. And that's just to make sure that you're getting enough. You're not going to overdose on these nutrients if they're things that you need. Well, it's very rare to overdose on either of those. So they're important things to making sure you're including in your diet. Calcium is often thought as from dairy, but lots of people don't eat dairy for a variety of reasons. So there's a wide variety of dairy alternates, but it's just making sure you read your labels that they've got calcium in them. So not all milk supplements will have, milk alternates will have calcium added. So do make sure that's on there, especially if you're having it as a calcium alternate. And vitamin D is generally going to be, although it is available in food, most of us will need a supplement because we cover up so much in the sunshine for obvious reasons. And it's not something you're wanting to get yourself out there to increase your skin access. So that's not a safe way to get vitamin D. So what I would suggest is, whilst it's in some foods, like animal fat foods here, you've got it in some fortified foods, supplementation is probably going to be one of the main ways you get vitamin D. And the other thing that's super important for our bone health is weight-bearing exercises like walking. So that's weight bearing, and also resistance training. So anything, whether it's body resistance or weights. And if you're not familiar with any of those, then that's when I definitely reach out for some help to get yourself moving with those different style of exercises if you're someone that maybe just walks around. The other thing that we know is really not great for our bone health is alcohol and smoking. Again, there might be something that you need some help to reduce or quit. And I definitely recommend reaching out for those as well, because they can have a real benefit for your bone health. The other thing that is very common, either due to breast cancer treatment or during breast cancer treatment, or maybe born earlier, or because the majority of people with breast cancer are women, is perimenopause and menopause. So some of you may have had a chemical or a surgical menopause, depending on your history, or be thinking about the future, about when there might be a natural menopause. Menopause is getting a lot more press at the moment, but that comes with with different challenges for someone who is after a breast cancer diagnosis. So because lots of different organs in our body are receptive to our hormones, it can really affect your well-being and your quality of life if you're struggling with symptoms. So chemotherapy, anti-estrogen therapies, or certain surgeries may have impacted and caused a menopause for you. It could be quite quick. There is lots of help out there, so I would suggest liaising with your health professionals to get the support that you need. If you're getting symptoms, it might be things like hot flushes, insomnia. There's lots of different symptoms that you can be getting, headaches, poor concentration, brain fog. Those things are very common, and some of them are common with different treatments as well. So I would always say, do ask for some support. There are some non-hormonal therapies that you can discuss with your team. But when it comes to food, there aren't any surprises or any quick tips that I can give you, but there is a growing body of evidence that you can have some small benefits by having a traditionally healthy diet, which is similar to our traditional Mediterranean style, for example, a very fiber-rich, plant-heavy, not exclusive, diet. There's also a need to increase muscle mass, and this comes with adequate protein and appropriate exercise. And this is no surprise, but all of these sort of things that I'm talking about today, quite repetitive, many layers, but the good thing is you're not having to do too many different things. A lot of them are the same message that's going to be coming through, hopefully. One of the other things that's coming through, and I guess it is in a lot of the other pieces of information, is around ultra-processed foods. And these are some of the things that I've got in this little photo here that are very high in simple sugars and high in saturated fats, and generally low in those sort of plant nutrients or fiber, those kind of things that we might be getting from other foods. So you're not needing to exclude them completely, but relying on them. Whereas during treatment, again, we're a little bit more relaxed when it comes to the advice, and often easy meals and a nourished human is the best advice. But now that we're moving post-treatment, we're a little bit wanting to reduce some of those foods. So if they did sort of creep up because, well, you may have needed them, and I recommend them at many times because they're very easy for you to get energy from. Now is the time when we might be reducing and trying to see what we can maybe make some more time around modifying things a little bit. The other thing that's important to mention when it comes to menopause is, with breast cancer, always run any supplements that you want to consider trying via your oncologist or your pharmacist. The evidence isn't huge with someone without breast cancer, but there's real risks that there might be something that you don't want, or that we wouldn't recommend you taking when it comes to menopause symptoms and after a breast cancer diagnosis. So do double check. The one thing that there is some other evidence on is more soy. So soy comes back into menopause, again, partly because it might help our body, trick our body into thinking that there's something in that receptor, and reduce some of the symptoms. So it's something that you can have safely, and then you can enjoy for different benefits as well. Just make sure I've sent everything. Okay, so Moving on to cardiovascular health. Unfortunately, some of the treatments, some of the chemotherapies, some of the targeted therapies can cause damage to our hearts during breast cancer treatment. So they are called cardiotoxic medications. So some of you may have had extra scans or extra heart function tests during your treatment to just make sure that there wasn't extra damage being done. But this is one of those longer effects after breast cancer. So cardiovascular disease is a risk for everybody, but what we're wanting to do is delay that risk as much as we can. And it's the same for yourself as you move after a breast cancer diagnosis. So when it comes to cardiovascular and heart health, so it's all our sort of blood plumbing as such, the systems in our body that feeds our brain and our heart and our lungs and the rest of our systems. Blood lipids or blood cholesterol levels are often thought of one of the focus. And when these are out of balance, they can cause these plaques in our arteries, as you can see in the image. And this makes it harder for our blood to pump through, especially if it's in certain organs that are super important. What can happen at the same time is our blood glucose levels. So if for any reason you may have diabetes before, or it may be something that someone develops later, for a whole host of different reasons. But when our blood glucose is higher and our blood is stickier, this can again cause issues with that flow. So it's not just focusing on the blood lipids and improving those, but focusing on your blood glucose. And that's another time when I just want you to think about how you might know if you're at risk or that you have cardiovascular disease. Most of the time, it's another trip for some more monitoring and some more blood tests. And unfortunately, that's the best way that we have to keep an eye on what's happening inside. Then if there is some imbalances with your cholesterol or blood glucose, diet can be another therapeutic measure to help support that, alongside other things like exercise or physical activity and medications. But diet-wise, some of the important things that, again, I'll just highlight when it comes to cardiovascular health can be things like good fats from salmon, olive oil, some of those, what am I thinking, nuts and seeds, those kind of things that have those really good oils in there. Again, it's less of those processed foods that have more saturated fats in there, less animal fats, and improving the heart health that way is another really important thing. And colours. So colours is coming through again from lots of our other tips and tricks, but the different colours in those plant foods represent really different antioxidants and plant nutrients that help support your health, including your heart health. So definitely making sure you're including a wide variety of those. They can be fresh, tinned or frozen. I like to say that as well, especially in times at the moment where fresh fruit can be a big challenge with some hefty price tags on it. There are lots of different consequences of cancer treatment. And when you finish your cancer treatment, often it can be a time of elation, but it can also be a super fearful time. You've come from a place of lots of support during your treatment, and I often hear it's described to me as dropping off a cliff, where you find you fall without that support, or you feel like you're falling without that support. And it can be a big challenge. So these sort of anything that you can tap into to be able to support yourself, do it for sure. Things like cancer-related fatigue, mental distress, any changes in your thinking or how you focus, and lymphedema. These are all treatable or supported things that professionals can really help you, and the support from Breast Cancer Care WA can really help you to improve your quality of life after your cancer treatment. So this all fits together. The other reason I like to talk about more broad consequences of cancer treatment is really because if you're feeling cancer fatigue, it's super hard to start a new exercise program. And it's super hard to explore eating different foods. So actually sometimes stripping back and starting with the focus on something that's not food related can really have a benefit to making eating easier and enjoyable for you and your family, which is one of the goals. So what about rehab? So I started these sessions with a session on prehab, which is really preparing for cancer treatments. And that was one of the previous roles that I had in a digital health company, delivering digital prehab. So prehab is the exact same principles as a more historic sort of the idea of rehabilitation. And really when we're moving in, wherever you're starting, your advice on supporting more holistically in a prehab or rehab scenario, the advice is the same. And it's being able to support that holistic approach, similar to what I was just talking about with reaching out for some support. But there are some formal rehab programs that you might be able to tap into at your cancer centre or via a care plan with your GP to be able to get some professionals in. So, don't be afraid to ask for that support, because we know that rehab can really help improve your general health as you move on after a breast cancer after breast cancer treatment. It can be, again, different things, and diet is just one big part of that. But the other part is still higher protein. So as you're recovering from breast cancer treatment, and it's not as much in the evidence around preventing, because this evidence comes from looking at people's nutritional status. So this is a different body of evidence. But what we know is your protein requirements are still higher than normal, up to 2 years after your treatment finishes. So during this stage is really when you're still recovering, when you're still finding a new normal. So it can take a longer time. A lot of people expect it to be a bit shorter, but it does take that length of can take that length of time. And a lot of people also, as we're getting older, need more protein. So it's trialing now some of those ways to incorporate and maintain protein into your diet as you recover and as you move into the years that come. So I wouldn't want you to drop the protein that I've talked about in other sessions. Do keep it up, as it helps benefit your, it can help your cardiovascular health. The plant-based proteins can help hormonal menopause symptoms by supporting that muscle mass and function, can help things like cancer-related fatigue. So lots of reasons to carry on with that higher protein diet. Okay, so before I go to questions, I've got one little fact or fiction that I'm just going to talk about, and that is the question that I'm often asked. Oh, actually, I'm going to talk about two. The question that I'm often asked is around supplements. Should you take them? Is there any benefit to supplementing things? And I think the answer is it depends. So unfortunately, for each one of you that is here and that's listening a bit later, you're going to have different requirements, and what you might need is different to someone else. But I would always say is making sure you check with your oncologist or your pharmacist, someone that can just make sure what you're taking is not going to have any adverse risks. There also is going to be some times where you might need to take some supplements. That's things like calcium and vitamin D. Those kind of things can really be a prescribed product that you then get some benefits from. So there is no recommendation unless it's specific for you. There are some risks with some high dose supplements. So again, we don't recommend things like high dose vitamin C because we are worried with certain treatments, it might dampen down the effects of, say, chemotherapy, where we're wanting an oxidation reaction. We're not wanting to dull that down. That being said, there are ongoing studies with different supplements at different rates in a controlled environment. So there might be new information that I can share with you in the next few years as time goes on around how those things might impact and benefit or not, if there's any risks associated. So it's definitely something that is being researched. The other thing that I wanted to talk about, and I meant to add it in with the diabetes side, but it is something that I have been asked, and it's around continuous glucose monitoring. So I can see many people sort of that I'm in contact with either ask me, or I have seen it visibly online as well around glucose monitoring. And it might be something that you, moving after your cancer diagnosis, is a question that you might have. And it's not something that I would recommend for there is evidence, not just myself, but there's no evidence to recommend that there's benefit for people who don't need to monitor their glucose. In fact, what I see, and there is evidence on, is that it can cause more stress, as our bodies do have a natural glucose spike after they eat certain foods. Some of those foods are fiber-rich and traditionally healthy foods, so it can be a bit confusing. So it's not something that we recommend you needing to do unless you have diabetes or are needing to monitor your blood sugar for something like that. So what I would do is stop sharing my screen now. I know some of you had some questions or wanted some of the pieces of information that I mentioned today, so I'm very happy to share. Whatever you need, I'll send those across to Chandrika a little bit later.
Absolutely. We'll send out the research references when we send out the recording. So Adele, how would you like to do the Q&A? There are questions in both the chat box and the Q&A box.
Cool.
Do you want to read them for yourself, or do you want me to read them out to you?
Do you want to see if you've got a few, because I haven't been looking at them. So yeah, let's go. Let's chat.
All right, let's chat. I'm going over to the chat box because more started there.
Cool.
So the first one was, yes, please send through the papers. The second one was a little bit more detail about people who have a diagnosis of an estrogen receptor or a progesterone receptor positive breast cancer. You did explain how the soy are like weak estrogens that fit into the receptors and therefore are blocking the impact of those naturally circulating hormones. So the question from Natasha is, can you explain the risks/benefits associated with soy? What does this mean for women that have an ER or PR positive as well as negative early breast cancer?
So what cancer professionals worried about was that because soya looked so similar to estrogen, that if it binded an ER or progesterone positive breast cancer cell, that it would promote the cellular growth. What studies have shown is quite the opposite of that. So that is where we now have that benefit of having soy. It is more with people with postmenopausal ER positive, estrogen receptor positive breast cancer. That's where most of the evidence is, but it is across a broad range of cancers. So it is growing, and our knowledge is growing. So it is still early days. What they're looking at more is dose, and they're also looking at when people ate soy. So again, a lot of the evidence is that if you eat soy when you're younger, there's even more benefits. So it's not clear cut yet that we're going to give this amount of soy to someone. Oh, I'm still sharing, sorry. That we're going to give this much soy as almost like a prescription. But I think there are studies, and that will be the future, that if we move down this way, there might be sort of adjuvant ways that we use soy to help support people with breast cancer, but we're not there. I hope, what I would say is, if you have any concerns about your disease, in particular, your particular type of cancer, chat to your oncologist, because they're the ones that will have seen those cells and know all the different types of things and their view on soya for you. So what we recommend as health professionals is that soy is safe and that it may be protective. I hope that's enough information.
Good. I think we're getting clearer and clearer as time goes on.
Yes,
that
we are.
Eating soy as a real food seems to be a positive thing, a helpful, healthy thing to do for calcium and for protein. So that was one of the questions. Do all soy milks have calcium or only ones with fortified calcium
Only
added?
fortified ones. So I've actually noticed coming into the UK, because I have soy for perimenopause symptoms, and not all of them have calcium added. So you do have to double check. In the UK, it was a far more had calcium, but over here they tend to add a whole variety of different things or not. Most organic foods here don't have added calcium either. So if you're choosing to have organic, it might not have the nutrients that you're eating that food for. So do just double check your labels, because it's a little bit of there's no standardization on it.
Okay, so we
But
want soy with added calcium.
if you're having it as
This,
a calcium source, because if you're having
right.
enough calcium in other ways and you're having soy for something else, then you don't necessarily have to worry about it. So if you were having enough dairy and enough other calcium foods and then soy is a top up, you could choose organic soy. It's not clear cut, if that makes sense. But if
Yeah,
you're
so a bit of
using it,
personal choice.
yeah, yeah, yeah.
That
So many
segues nicely into
nuances.
a question that I popped into the chat box,
Oh, yes.
which is around something that my children liked growing up, which are the sort of mock meats made with a soy protein. Would they fall into your ultra processed foods
That's
bracket?
a great question, because it's another one of these nuances around foods. Because yes, it is an ultra processed food, but then some other ultra processed foods are things like tomato paste. So we're looking at different things and what they mean for you. So some people like to explore the mock meats as part of exploring a vegan diet. But I wouldn't suggest they're your main source of vegan protein if you were moving into that way. I would have a variety and include them as a variety. So making sure you're having other plant-based foods. So they're fine to be included as part of a general diet, but not to rely on, because they are still processed. So it's something to, they can help people be nudged towards more plant-based eating, depending on what your family is like. But for most people, you don't want to rely on them. But it's not as clear cut, because if someone chooses not to have meat and that's all that's there, then definitely it's a protein source, and it's going to be that nourishment for that day.
Yes, I've observed that they're quite high in sodium, which could be our link to the cardio question that came
Yes.
next. Joe wondered whether hormone blocking medications
Mhm.
cause cardio issues, cardiac issues.
Not directly, but what the reason one of the many reasons that there's an increased risk of cardiovascular disease for women on a blocker is the role of estrogen in heart health and cardiovascular systems. So it is a key, it's part of the way that our circulation stays more functional using estrogen. And as estrogen decreases in the body, there is evidence that cardiovascular health can decrease. So it isn't something that's caused directly by the drug, but it's caused by the lack of estrogen in the body. I would suggest, when you're worried about that stuff, is have a chat to your pharmacist, because they're going to know what dose you're on and how long for. Your GP is also going to know if there's any other cardiac risk that you might need to incorporate in sort of your health plan, and how we can monitor things in another way, because the hormone blocker medication is what's the important stuff to treat the breast cancer. There's lots of other treatments that we can do to help support your heart health, food being one of them, but there's other things that you can do. And I should have put salt on the slide. Now I've forgot about that.
That's right. That's what the questions are good for, right? They start to prompt
Excellent.
other thoughts.
Yes, definitely.
Another question here is any evidence for mushrooms and turmeric?
I'll start with the turmeric, because I'm more au with turmeric. So turmeric is being studied in different doses, specifically in um, colorectal cancer. So they're looking at it in alongside some treatments for colorectal cancer. So there's some interesting evidence that might come up, but it's also a high dose antioxidant. So we're a bit cautious about using it freely, but double check with your particular treatment that you're on. Most of the time post-treatment, those things were a lot more flexible with being able to explore those things. And your doctor might be more pragmatic about having it after you're on certain treatments. I have had some clients that have had bad gut reactions. Only a couple, but they do stick in my mind. So while some people might be like, yeah, all good to try it, and then you do try it, and actually it's just not something that sits well with you. The mushrooms is something that's a bit more new, but it is being studied as well. So watch this space on that. There isn't any recommendations at the moment. I wouldn't recommend trialing them alongside any treatments, but if you did, just again chat with your doctor. But it is something that we are looking. I'm not looking at it. It's being looked at, which is good. I mean, a lot of our chemotherapy products came from plants, so it is one of the ways that we find new treatments. The thing with research studies is, though, that they're always done alongside the gold standard of treatment. So it's not recommended. It's a complementary, these things, rather than alternate. And I guess that's the other thing to be important, to be thinking about.
Yes, very good. So again, I think the just eat real food message comes through quite strongly, doesn't it?
Yes.
Mushrooms as a food are fine, turmeric in your
Mushroom,
curries are fine,
definitely.
but the
Yeah.
supplements, that's the unknown kind of
It's
area.
the unknown. Yeah, definitely.
Yeah. Okay. Oh, again, we're going to jump topics. This is very good for your psychological flexibility, Adele.
Oh,
Another question that I popped in when you were talking about calcium and vitamin D, I wondered, I'm sure I've seen around the traps that vitamin K is required for calcium to be absorbed into the bones.
so
Is
I
that
think
right?
it's probably phosphate you might be thinking of, which
Oh,
is another important nutrient for bone health. Vitamin K, though, is important for general health. So what vitamin K or potassium is in, sorry, no, I'm getting confused. Vitamin K for absorption of calcium. I'm not sure, actually. I'm thinking of the element potassium.
that's okay.
So vitamin D is what helps absorption of calcium. So I would need to double check on my metabolism if vitamin K is required. Vitamin K, though, is super important for clotting and blood health. So that's one of the things that vitamin K is important for. One of the main sources of vitamin K is actually our gut bacteria. So if we have adequate fibrous foods, our gut bacteria should produce enough vitamin K, a particular type of that. But there are food sources for vitamin K, but it's usually clotting that is involved with. But potassium, which is what I was thinking of, is what we get a lot of from fruit and veg. So it's really important for our sort of our blood concentration. So that is another important thing to finish off where my brain was going.
You're doing well.
Thank you.
A question from Natasha. She's asking about cancer cells and the fact or the idea that they love glucose, which I think you've addressed in some of our other webinars.
Yes.
Her question specifically is, can you comment on a healthy and balanced ketogenic diet as well as intermittent fasting?
So I will take the first question, the first part of that, which was the ketogenic diet. So to for those of you listening, if you're not sure, a ketogenic diet is where you heavily restrict dietary carbohydrates to push your body into a state of ketosis, which is where your body's using ketones as its main energy source. So I'm not a keto trained dietitian, but there are keto trained dietitians. It's a diet that's used in epilepsy, particularly in children's epilepsy. They've used it. There is some ongoing studies of ketogenic diets in people who have brain cancer. And there is, again, alongside other treatments, they're using a ketogenic diet there. One of the main things is that in humans living in the community, it's actually super challenging to get to an actual clinical ketogenic diet. and there isn't any evidence of it being beneficial. There is more evidence on it being harmful in the fact that it can cause malnutrition for people who are trialing it in a free living, unsupported environment. So there isn't anything that I can recommend on a ketogenic diet, but if it's something you did want to explore, I would suggest finding a health professional that can just help you make sure you're getting enough other nutrients, and just to decide on how you wanted to explore that trial. So it's not that it's a no, it's something that I just would worry about someone doing it without professional support, especially if they're juggling recovering post-treatment or during treatment. The theory is that if you starve the glucose from a cell, that they would stop growing. However, cancer cells also need other nutrients. So we are not at the stage yet where we are using diet to reduce cancer cell growth. There are treatments, not as much in breast cancer, but we use, say, kidney cancer, they use these anti-angiogenesis, which is anti-blood vessel development. So they stop new blood vessel formation, which stops the nutrients coming to the cell. So we're manipulating that glucose or nutrient requirement of a cancer cell in different ways, but we don't have that diet answer yet. When it comes to intermittent fasting, there is some studies going on alongside chemotherapy to reduce side effects. So there's certain days that some people are fasting to a particular regimen, again, usually supported by a professional to be able to possibly minimize side effects. So there has been some positives, but the studies have been hard for people to stay on. But in individual circumstances, there might be a supported way that you could incorporate that. Again, moving into post-treatment, if you were looking to use intermittent fasting as part of your way of you eating healthy, it can be something that some people find works for them in, like the 5-2 works for some people, not everybody, but some people do find it helpful. There is a nutritionist, I think she's a dietitian, Michelle Harvey in the UK. She's done quite a bit of research around studying intermittent fasting and breast cancer. So it might be something that you want to look her up, because she's an advocate for it if it's something that works for you. I'm just making sure you're not stressing around food, you're not worried about food, you're not then binging after. Those kind of things is what I find are some of those risks that can come with those diets. Hopefully that helps.
Good. I'm just jumping around between the Q&A and the chat
Cool.
box. I think you're covering a lot of people's questions. There's two at the bottom here, one about wine and one about Pepsi Max.
Oh, cool. Okay, tell me, what's the wine one?
Can you recommend a quantity of wine that is acceptable if you don't want to give it up altogether? And is red better than white?
I'll start at the back end of that. Red isn't better than white when it comes to cancer risk. I would say if you choose to drink alcohol, pick the stuff that you're going to enjoy, because there's no point in having it otherwise. NICE, which is the National Institute of Clinical Excellence in the UK, recommend no more than 5 units a week, which is 2.5 standard drinks, as a not necessarily a safe level, but as a maximum level after breast cancer. I wish I could give you better information, but there's not much more coming through. We know that it's not, there isn't any health benefits, but there are, in Australia, there is a big social component to drinking. So if it was something you could stick under that 2.5 standard drinks a week, that's where the evidence is at the moment.
Thank you. And what about Pepsi Max? Would 3 glasses of Pepsi Max a day be acceptable, or should it be stopped altogether?
Well, I don't like either end of those. Hopefully, you can tell by now that I'm a bit more of a moderate person with my advice. So, sweeteners always get bad rep. and I'm actually surprised I haven't been asked as much about them. I think the evidence is coming through that to safe levels where you're having something sweetened a day is not going to have any detriment for yourself. I would say that it's the amount. So again, that frequency, and if you could try and reduce it 1 or 2 a day and have some other fluid, could be a benefit. The things like tea, coffee has some added benefits of antioxidants, can be decaf or non-decaf or caffeinated. So there are some other things that you could explore if you're wanting it for a caffeine hit that have some other health benefits, rather than just the sugar-free. But the sugar-free is better than 3 sugary ones.
There's a question here about meat consumption that also has 2 parts to it. The first part is, are we concerned about estrogen in meats, particularly chicken? The second part is, what are your thoughts on meat consumption increasing inflammation in the body?
So chicken and hormones, there are hormones used in keeping animals healthy in farming. There are different requirements that I'm not across the sort of the exact levels with each different stages, and organic versus non-organic and free range. They all have different requirements about what they can use within their farming. A lot of that is centrally reported within standards, and how it's not something that's always communicated well with us. And I don't think we have enough as sort of health professionals to deliver specific changes on that. What we know is that more plants is better long term, but we also know during treatment, we actually recommend, if you are eating animal protein, to keep eating it because it's absorbed by the body better. So the nuances around that is that I can't give you probably the exact answer that you want. The benefits of chicken and other meats are that it's leaner than other meats. And I think that's where some of the next question around inflammation and meat products, where we're moving towards more plants, but not exclusive, because it's more that if we have too much of these things, then our body does it. It's not that it doesn't digest them, but it isn't getting enough of the other nutrients that really help to support it. So it's having that variety of food that enables you to have a good balance of nutrients, and it can include meat. You don't have to be exclusive, but less meat is showing to be better in the evidence for whatever reason. There's probably lots. Hopefully that's diplomatic enough.
So lean plant-based is the ideal, a little bit of meat for your preference and for your protein.
Yeah.
And if you need that kind of bioavailable nutrition, is appropriate.
Yeah.
Yeah.
Yeah. Yeah. The other thing I think with red meat is, the recommendation is 500 grams or less, because there's also iron and things like that that are really important. So it's not all about one particular part of a food. Foods are generally a composition that are going to give us some benefits. The other thing with eating too much fiber, it can affect some people's bowels and can inhibit absorption of some nutrients. So it is that composition and balance, rather than focusing in too much on individual pieces of the puzzle. Sorry to butt in.
No, you're doing a great job. Are you okay for a couple more questions?
Couple more, definitely.
Yep. So there was another part to an earlier question around juicing. If juicing veggies only and or with the addition of fruit, does that have much impact on blood sugar?
So I'm always advocate a smoothie for a juice, because you get the benefits of the fiber in the food. If you juice a fruit, most juices spit out most of the fiber, whereas smoothieing things, you get a bit more of that fiber in there. But you can combine, juices with certain things. They will have the less protein or fat you have in a drink, if you've got carbohydrate in it, it will spike up your blood sugars. But it depends on why you're worried about that being a problem. If it's, you're having one juice a day, it's, a reasonably small size, not just a big tub of juice, then that's a part of, you know, a healthy diet. If you're having lots of juices often, it is going to spike your sugars more often, which is where the problem comes, and it will probably also hurt your teeth. So it's making, if you're having it more like a smoothie, can be a bit more like a meal. You can add some avocado, you could add some yogurt, you can add something in it to make it a little bit more nourishing, but it depends on what your goals are. So I wouldn't worry about an individual juice spike if you're enjoying your juice. I like a beetroot and carrot juice for ginger if I go to Boost Juice, but there are other juices available. But yeah, it depends. So it will spike your blood sugar, but that is for most people not a problem if it's, you know, not often, not every day, not all the time.
Okay. Any thoughts on protein powders?
Yeah, I think they are used in research studies. There isn't any safety issues apart from a soya protein, which I wouldn't want someone to be using too much of with breast cancer. But I do use them therapeutically with people who are needing to increase their protein. So if you're struggling, they are a good source. Also, if you're coming back into life after breast cancer treatment and you need some protein on the go, they can be another great source to top up. But what you're wanting to do, the only thing is they don't have anything else in them. So it's maybe including them in a smoothie or in meals so that you're getting other nutrients as well. So they can be a great supplement, but they're not the full ticket.
Mm-hmm. Mm-hmm. Okay. Yep. So I'm just scanning the other channel. I think we've answered those. There was a more
Excellent.
specific question about how much protein and how much soy per day or per week.
So it depends on your weight for protein. So for most people, sort of, I would say between 1 and 1.5 grams of protein per kilogram per day. Soya, more of it's around portions, and it is the 2 to 3 portions a day that's around 60 milligrams. If you Google soya portions, it will just have, you know, it's like 1 cup of soya milk, a handful of edamame, those kind of things are the portion sizes. They don't have a size specific increase, which is probably a detriment on the research rather than how you would be able to have that, because I would assume people in a larger body probably need a bit more, but we don't have the evidence on that, just the way that the research is done, not as inclusive as I would like, but that's the best that I can recommend for now.
Very good. That's pretty specific, actually. That's good.
Oh, good.
Is soda/mineral water problematic? For example, a litre a day?
So I hear varying things about this. Some people think that there's too many minerals in mineral water that can affect sort of people's calcium levels and things like that. But I don't think any of that's ever been researched. The other thing is that carbonated water and bubbly stuff can impact some absorption of things. So again, it might be something not to rely on, but having occasionally is fine. Similar to the sort of Pepsi Max question, you want a bit less if you can, but it's fine. We don't have sort of recommendations on carbonated water. It's just there are some different things to consider when it comes to absorption and bits like that, and your teeth.
Mm-hmm. A follow-up question about water. Do we need to filter our tap water?
So the tap water question I get asked a lot, and most tap waters is absolutely healthy and safe. You might want to filter it for your taste or your personal preference, but when it comes to health recommendations for evidence, tap water is absolutely fine, but it depends on your personal preference. So I would say, though, we definitely recommend tap water over bottled water for sustainability, and actually there's some issues with immunotherapy, sort of immune systems. We don't recommend bottled water. It's quite wild. Tap water is much fresher and safer.
That's very interesting.
It's more for hematological cancers. We actually, there's a risk with their immune systems being so low. So yeah, learning about that has made me even more into my tap water.
Good. And maybe, I'm just thinking pragmatically for people who are asking a lot about drinks, maybe a squeeze of lime or, a little bit of something flavoursome in your water would mean that you could get that
Definitely.
hydration.
Definitely. Yeah, mix it up, whatever works for you. And that's where it's definitely different for everybody, for sure.
Uh, if you've got time, we've got just a couple more questions. Are you okay?
Couple more questions, yeah. And then I better duck off.
Any truth in the benefits of powdered collagen for improvements to immunity?
Immunity, I can see that the theory. I'm not up to date on the latest on collagen because it is something that we're growing the evidence on. So we didn't think it did anything for skin, and then we've changed our tune as the evidence have grown. So that would be a watch this space and see. There is Dr. Tim Crow. He is a dietitian. He's done a big review on collagen recently. So it might be something to have a delve into. He's a really respected academic, and he's been keeping himself up to date. So that would be who I would lean on to have a look at collagen and how it might help.
Great.
Yeah.
Also, can you remember or can you tell us who the person you referenced from the UK who'd done the work on intermittent fasting is?
Michelle Harvey, Dr. Michelle Harvey.
Okay, I'm just popping these
No
in
worries.
the chat box so people have them in writing. And
Yes.
don't forget as well, this is recorded, so you can always go back if there was something that you missed. So one very last question that I think should sum
Thanks.
things up nicely is who should people go to? Can they see someone like yourself, an oncology dietitian in Perth, for more personalised support?
They definitely can. But where that person is one of the challenges that I find. Most cancer centres are often stretched when it comes to dietetic services. So it is a little bit of a lottery. Depending on where you are, so I do some clinical supervision with the cancer dietitians that work for WAX. So they're everyone outside of Perth in West Australia. So we have some supervision sessions. So there's been a couple of people that have sort of seeked out that. And then if there's anything specific, those colleagues can ask me for particular questions for support. I'm not currently seeing freelance people at the moment. I am hoping I might change that in the future, but it's not something I do. But I would always sort of Google accredited practicing dietitians and see what's available in your area. The dietitians, sort of the APD status, means that we are trained to a different level to, say, a nutritionist, and we can really help support the clinical requirements and sort of understand a little bit more about some of those clinical situations that you've been through and what you're moving through. So it is a little bit of a lottery. I'm still needing to find a couple of people that I would want to refer you to, but definitely ask your centre. It's something that they could hopefully recommend, whether they have someone in-house or that they can refer you to. Ultimately, if you do get stuck, definitely link back in because there might be some other sessions that we could plan in the future or something that can help bridge that gap if it's something that's coming up a lot.
Sure. We often give people the recommendation to go to the Dietitians Association of Australia website where there's a searchable list of APD dietitians who have an oncology
Perfect.
specialisation. Is that appropriate?
Definitely, definitely. And it's just finding someone local, I think, is one of the challenges. Many people will do telehealth though. So I think there's a few more over east that are oncology trained that might have be accepting freelance patients. So yeah, fingers crossed that there's more and growing.
Great. So you can always contact Breast Cancer Care WA. Our nurses are pretty well versed in the latest nutrition science, although not obviously as specialised as a practicing dietitian is. And you could also think of calling the 13 11 20 Cancer Council number. They will also have access to things that are evidence-based and resources they can share. So I think we're out of time today. It's such a juicy topic, and we really appreciate your expertise, Adele. It's always a delight to listen to you, and it's wonderful to see such enthusiasm and so many good questions coming through. Thanks again for joining us. We've got one more of these sessions with Adele, which is focused on eating well with metastatic breast cancer. And I actually don't have the date in front of me, but it's coming up fairly soon. So
Excellent.
stay connected with our organisation, and we will send you out a link to this recording. It'll also go up on our website, and that will be a resource you can look back at anytime in the future.
Thank you all.
Thanks, everyone. See you later,
Bye.
Adele.
Bye. Bye.